Okay, Assalamu alaikum. My name is Dr. Farooq Pasha. I'm the Director for Hyperbaric Oxygen Therapy in King Faisal Specialist Hospital and Research Center. Alhamdulillah, Mustashfa Malik Faisal Takhasusi Markaz Al-Abbas, King Faisal Specialist Hospital and Research Center is one of the pioneers for hyperbaric oxygen therapy in the Kingdom of Saudi Arabia. We were the first hospitals in early 90s who had the first chamber in Saudi Arabia. And since then, we have established and improved on the service in King Faisal Hospital. We normally deliver 100% oxygen to these patients, and we basically give them at high pressures of about 1.5 to 3 atmospheric pressure. And the reason we do that is that we want to fill the body with oxygen so that the lung can take up as much oxygen as they can. And after that, that oxygen gets absorbed in hemoglobin and plasma, and we increase the plasma concentration of oxygen in the blood. The reason this is important is that because we want to deliver high concentration of oxygen to the tissues. How does it help the tissues? We know that high degrees of oxygen in the tissue helps with angiogenesis, that it helps your blood vessels to grow. It helps healing of the wounds, so basically it decreases the toxin and the harmful bacteria. It is a good antioxidant. And not only that, it helps to repair the tissues and it helps with protein synthesis. And when it acts on these 5 areas, your wounds will basically heal much more quickly as compared to normal. Once you fit the criteria, then a staff will basically ask you to come and attend, and they will give you a patient information leaflet, and you have to basically follow certain conditions before we can basically give you hyperbaric oxygen therapy. There are certain things that has to be followed, such as you should not have any cream or chemicals on your skin because oxygen is flammable. You have to wear our specific clothes. You cannot go into the hyperbaric oxygen therapy wearing your own clothes or any piece of jewelry because oxygen is combustible. And our staff will make sure that you are safe enough. Once you are in the hyperbaric oxygen therapy, staff will be with you at all times when you are receiving the hyperbaric oxygen therapy in the chamber, from the start of the process till the process ends. Once you're going to go and sit in the chamber, 2 things will happen. The first thing is basically oxygenation, so you will be asked to wear a mask or a hood where we'll deliver you 100% oxygen, and then the process of pressurization happens, which is you will hear some sounds because we increase the pressure within the chamber, and you will feel as if you have got some pressure in your air. And it's the same feeling when you basically go up and down the mountain, the feeling that you get in your air. It is slightly scary for the patients, but it only lasts for a few minutes, okay? And once the pressure stabilizes in the chamber, then that feeling goes away. Then you have got a process for about 60 to 90 minutes when you will receive your hyperbaric oxygen therapy, pressurized oxygen under a pressurized environment. And during that time, you can sit and relax. You can either watch a TV, you can listen to music, you can listen to Quran, and during that time it is fairly comfortable. After 90 minutes, then basically decompression starts to happen, and again you will have the same feeling. Sometimes people feel some pressure within the air, okay, which lasts for a few minutes, okay, and then the process stops. My staff will make sure that you do not suffer from any side effects of hyperbaric oxygen therapy, but obviously some people do develop problem with the air, so they get sometimes rupture of the tympanic membrane, or the tympanic membrane goes in. But make sure that, and please be aware that we will give you medications which are called pre-medication before the procedure. So we give you a set of antihistamine, we give you some vitamin E to prevent that from happening. But if any complications of hyperbaric oxygen therapy will happen, then my staff will refer you to the appropriate services, which is the ENT services within the hospital. You will be given a pre-information leaflet, you will be giving a post-information leaflet. At any time you will be in touch with my staff, and if you develop any complications and if you've got any questions, we will be very happy to answer that. I hope you have a good journey through the hyperbaric oxygen therapy department, and if you are referred, I will make sure that my staff will take good care of you. Thank you.